McKee, who's here, and we're excited about that, as well as Secretary Pryor. I'm looking forward to our discussion today because it's an opportunity for us to get together. We know that there's been a lot of excitement and energy and different things going on, different questions. We want to be able to address them today. By and large, we have some good news stories, so we want that to be a key component that we'll take out of this. Our numbers are coming down, vaccines are going out, and we'll have some updates in terms of restrictions given what we are looking to do. So let's focus on that together and be real about what we're experiencing so that all Rhode Islanders can have a path forward. As always, I'll get us started with the data. As you can see on our dashboard, yesterday we had 496 new cases out of 17,850 tests that were done. That is a percent positivity of 2.8%. Very sadly, we also saw another 11 COVID-19 associated fatalities. Now, we talk about how critical our hospitalization data is. We are seeing good trends in our hospitalization data. We now have fewer than 300 hospitalizations for the first time since early November. Our weekly average is down to 400, a significant improvement from just last week when it was nearly 500. Our percent positive rate has been consistently decreasing for the last several weeks, and our weekly average has been below 5% for the past 2 weeks. This trend in percent positivity is really great news. What's important, however, is for people to keep in mind that we are doing an enormous amount of testing. We continue to lead the country in testing. In the last week, we have run more than 110,000 tests, which is an incredible number and such a credit to the entire team of individuals that work day after day to help make that happen. Thank you. Doing so many tests keeps our percent positivity down. That's the goal. Even though we are still seeing hundreds of new cases per day. So while there's no question that our data look better right now, it's important to recognize that there is still a lot of virus circulating in the community. The key with the extraordinary amount of testing that we're doing is to make sure we are doing everything we can to identify all of those cases of virus circulating, which we are able to do effectively. There are a lot of factors contributing to our improving numbers. Let's talk about them. We took aggressive action with our pause to arrest the steep incline we were on around the holidays. So we saw what was potential to happen. We made an aggressive move to hinder that. And we've been able to successfully ward off from having to go into those significantly high numbers. Also, we have gotten more than 100,000 doses of vaccine into people's arms. And in particular, we have gotten those doses into the arms of some of the most vulnerable Rhode Islanders. That also is instrumental in impacting our hospitalization numbers, as well as what happens with deaths or otherwise. And another key is that we have treatment for COVID-19 for people who are at highest risk. And we met our goal of treatment doses per week and are now increasing that goal even further so that we can continue to distribute it. Another reason why the data are looking promising is that people, Rhode Islanders, are doing a good job practicing social distancing and wearing your masks. I was asked about the flu here last week. We're seeing virtually no flu. We've gone back and checked and assessed overall in Rhode Island right now. And that is evidence that the infection prevention measures you are taking are working. not only for COVID-19, but also for flu and other respiratory viruses. Having said all that, what concerns us right now are the new strains of COVID-19 that are circulating in the world, in the United States, and in our region, in neighboring states, also likely here in Rhode Island as well. Viruses constantly change their mutation, and new variants of a virus are expected to occur over time. Sometimes new variants emerge and then they disappear. Other times, new variants emerge and they persist. Many variants of the virus that causes COVID-19 have been seen in the United States. When you read about them in the news, they are usually associated with the place where they were first identified. So, for example, you've probably heard about the UK strain or the strains that were first identified in South Africa or in Brazil. So we have not definitively seen them here yet in Rhode Island, but it's important to know that we have a systematic process in place to monitor for them. And it's even more important to understand with those new variants being in our neighboring states, officially identified, and in other places throughout the country, it's only a matter of time before they are here in Rhode Island. And as an infectious disease specialist myself, I can tell you, in conferring with my colleagues, there's concern about this strain and how transmissible it is. These variants seem to spread more easily and more quickly than other variants, which would actually lead to more cases of COVID-19. An increase in the number of cases of COVID-19 would then lead to more hospitalizations due to COVID-19 and potentially more deaths, all of which could increase the strain on our healthcare resources, which is always what we are looking to protect against. So far, studies suggest that the antibodies generated through vaccination with our currently authorized vaccines will provide some protection against these variants. However, this is still being closely studied. While we have every expectation that we will identify these new strains here in Rhode Island, we cannot predict how they will affect our state. All we can do, and what we have been doing, is looking at the data and our models, the projections, what they are potentially saying, and doing what we need to now to protect against that. We want to have the full strategy for what you can do to continue to protect your household against COVID-19, including the new variants that would come in the future. Because we have not identified them directly here in Rhode Island, there's a sense that we may have another month or so before it really begins to pick up. But we want to make sure now that you have the tools needed to prepare. The place to start is with masking. We've said from the beginning, as soon as we understood that, masking is one of the key ways to prevent transmission and to protect yourself and your household. Everyone needs a high-quality mask to prevent the spread of virus and for your own personal protection as well. With a virus that's even more transmissible, it is all the more important to make sure that you have access to the best quality masks that are there. We are working now to bring more high-quality masks into Rhode Island and to get them into your communities. Over the next week, we're going to share more information on what we mean by a high-quality mask. What are some of the things you can do to get access to more masks, to use the masks that you do have even more effectively, or other tools that will be helpful in preventing the spread and combating the increased transmissibility of the new variant. The second focus area will be ventilation. We've known that when you are indoors in poorly ventilated areas, that is one of the recipes for super spreader type events, particularly when that's over an extended period of time. So we're going to be encouraging businesses and public places to continue to work towards improving your air quality. That's going to be a way to help combat what's to come with the new strain. The aim will be to have at least 2 air changes per hour. Again, we'll be back with more specifics on what that means and what steps we can all take to achieve ideal ventilation, knowing that that's going to be a helpful approach. And finally, setting aside where you work and where you live, we're asking people to minimize how long they stay in any public indoor place. Unless you work there or live there, you should avoid being indoors somewhere, particularly where there is poor ventilation, for any longer than 1 hour as a general time frame. That's a tool that you can work with. If you're in a place where the ventilation is poor, and it's a place that you don't have to stay for a prolonged period of time, you're not working there or living there, think about an hour time frame to be able to get in, do the things that you need to do, and then to continue to move on. After I'm done speaking, Secretary Pryor is going to discuss some updates that we're making to our current COVID-19 restrictions for businesses and other venues. These updates are based on the improving data situation that I outlined earlier and will ultimately include some of this information that we want to support businesses with in terms of improving ventilation and understanding the time constraints and risks when there is a poor ventilation environment. We understand how challenging this year has been for the business community and for everyone throughout Rhode Island. We want to express the importance from a public health perspective of our economic health as well as of our public's health. If the data indicate that it's okay to ease some restrictions in some areas, even if it's just for a temporary period of time because of our concern about the variant in the future, it's something we believe in being able to do because we know the hardships that exist. So in advance of getting into that good news story more, I want to also be candid with people about the fact that because of the new strains, while we might make some improvements in terms of restrictions, they may have to be temporary because we're moving in the direction in the future of dealing with the new strains that may be coming, and it may require additional restrictions to prevent cases, more hospitalizations, and more deaths. We are again seeing the potential for those increases, and we know what works to be able to stop it from getting overwhelming. So it's possible that in the near future we would have to do something, but because we recognize the hardships and what's in place for right now, with how good we're doing with our numbers, we do want to take advantage of this small window to be able to see what type of restrictions we can ease to support our business community. So Secretary Pryor will come up to share more on that topic. The other major topic that I want to discuss today is our vaccination campaign. As I mentioned earlier, as a starting point, 108,924 doses have been administered in Rhode Island. And unlike what's been stated in other states, we can confidently say we have really focused on getting it to our most vulnerable Rhode Islanders. We know that there are more that we need to get the vaccine to, and as supply comes, we're laser focused on being able to do that. But we want to recognize the large groups of vulnerable Rhode Islanders who are at highest risk that we have been able to get vaccinated, well over 100,000. We crossed this 100,000 doses mark on Sunday. It is a great accomplishment that has taken an enormous amount of coordination, particularly when you're focused on really getting at the individuals who need it the most. A lot of people deserve a thank you, starting with the vaccinators, other healthcare providers, our mayors and town managers, other leaders in all the municipalities throughout the state. And I really want to lift up our RIDO and state vaccination team. They have been working tirelessly. Alicia Mahalakas, Tricia Washburn, so many of our partners on a massive team of individuals who care, who are committed. They don't always get the limelight and oftentimes get the hard parts of what's gone on, but I will continue to call all of them out as my heroes for helping to push us through this very critical time. We are regularly looking at our inventory of vaccine and are evaluating how we can get more people vaccinated more quickly. We know that that's critical. We know that that's what is important for us as well as for Rhode Islanders, especially for our older adults, and know that we are laser focused on moving that forward. One example of how we are being agile and continually looking to see how we can improve is that we were able to free up roughly 5,000 doses of vaccine for municipalities to begin vaccinating people who are 75 years of age and older last weekend. I want to pause a moment to really reflect on that. Our initial goal was to start vaccinating once we had that supply a week or so from now, that group of people. And we knew that wasn't soon enough, but given what we were getting from a supply standpoint, that was the time frame. However, with continuing to assess and reanalyze and measure every single dose and make sure that none were going to waste, we were able to pull together enough of these vaccines to be able to start vaccinating 75 and older earlier. And we looked around our state to say, what's the best way to get this out quickest? We know how critical our municipal partners are, and they were already working on the plan to get going by mid-February. And instead of the vaccines just waiting on the shelf for that time, we turned to them and said, let's do this together. And it was bumpy, and it was rough. Many of you heard about it during the week. But all in all, with a short period of time advance notice, we have been able to vaccinate 5,000 individuals, 75 and older, who otherwise wouldn't have gotten it at this time, would have gotten it a couple of weeks later. But it's an example to show, even if it's bumpy, even if it can be frustrating, we're going to do whatever it takes with our partners to make sure every individual at highest risk can get vaccinated as quickly and as early as possible. We know that getting this population of 75 and older vaccinated quickly is critical, which is also why many people 75 and older started getting vaccinated in congregate settings several weeks ago. It's important to know we're not just starting 75 and older now. We've been doing it for weeks. We're now continuing to expand to the additional groups of 75 and older. Because getting this population vaccinated quickly is critical, we are enormously appreciative of the creativity, flexibility, determination, and hard work that the cities and towns have put in over this last week and weekend. The storm on Monday caused us to have to do some rescheduling, but on Saturday and Sunday, almost 4,000 Rhode Islanders 75 years of age and older got their first doses of COVID-19 vaccine, and that's fantastic news, and we've been able to push out all of the vaccine that we have found from that. Because we knew that it was bumpy, given that short notice, and because we want to prepare for continuing to do this as quickly and effectively as possible for when we had originally scheduled to, starting mid-February, we have been using the lessons learned from that experience, meeting with the cities and towns throughout this week, with the Lieutenant Governor McKee's leadership and their partnership, and we're gathering feedback in real time and are looking ahead to how we can continue to get Rhode Islanders vaccinated in the most efficient and equitable way possible. Okay, so last week I spent a lot of time talking about the who. Who will get vaccinated and in roughly what order? What is phase 2 going to look like? What's the overall timeline? That was so that everyone could have an understanding of who was coming next. If you recall, the approach we are taking is a data-driven, science-driven strategy using a framework of age, high-risk conditions, and geography. I will reiterate that this approach aligns directly with the input from our federal partners, the Centers for Disease Control and Prevention, and with the input from our excellent subcommittee on COVID-19 vaccine, who are all committed experts who know the latest on the data and the science and what's needed at the community level to help drive us forward. Thank you to that committee. You're going strong. We're going to continue working with you and relying on your input to help make this as effective as possible. We talked about the who last week. Today, I would like to talk about the where, the when, and the how for vaccinating going forward. In this regard, there will be some similarities to our approach to testing. There are many different locations throughout the state where you can go now to get tested for COVID-19. Not all of these testing sites are managed by the state. However, we do have a set of state-run testing sites, and there's a place to go online if you want to get tested at a state-run site, which is portal.ri.gov, and we still encourage everyone to go there. But there are also multiple other types of testing sites. You can get it through your provider, and you can go through other more locally run sites as well. We've also connected with pharmacies for testing. The success of that approach, again, we tested over 110,000 people last week. That success, that framework, is what we want to bring to vaccinations. I'll also remind our lessons learned with testing. We came upon a bumpy part with testing halfway through the pandemic as cases began to rise further, where our test turnaround time was slow. And it was tough because we wanted it quicker, Rhode Islanders wanted it quicker, we were hearing about how frustrating it was that it was taking so long. And we promised and said, we hear you, we agree, we are working on it, and we will get it better. And all of you can attest to the fact that now, for weeks, if not months, our test turnaround time consistently is 2 days or less. We heard you, we knew it needed to improve, we worked on it, we did, and it has consistently improved. I want to give you that as the approach for how it will work with vaccines. We know that it's bumpy. We know our vaccine supply is low. We know that we're building out more partnerships on how to get vaccines out better, faster, more effectively. And it's tough right now, just like when that test turnaround time was taking a week or so. But we are confident that it will get better. You can trust, given what we have shown in the past, that we hear you, we know it, we're working on it, and we will continue to focus on that until consistently everyone is getting the vaccines that they need. We also know that over time, from the feds, the supply will increase. We're making sure that we are ready for that surge. So there's a lot going on right now, and I want to make sure you continue to hear the good news of how we're going forward and can think back to the success that we have overcome in the past, knowing that we will do that here. Vaccinating in Rhode Island is going to use a similar model as what we have used with testing. There are going to be three main types of places where people will be able to get vaccinated. The first location where vaccine will be available will be retail pharmacies. In the near term, that's going to mean CVS and Walgreens vaccinating people who are 75 years of age and older, although we expect multiple additional pharmacies to come on board as well. So here's the good news with vaccinations. 14 different Walgreens locations will start administering shots starting next Tuesday. The registration process will start Sunday morning between 7 a.m. and 9 a.m. This is for individuals who are 75 years of age and older. You can schedule by going to walgreens.com or calling your local Walgreens directly starting Sunday. Earlier this week, CVS also announced that vaccine will be available for 75 years of age and older at several sites in Rhode Island, also starting next week. They will start vaccinating at sites in Providence and Johnston on Sunday, and you can start scheduling this weekend as well. To register, also go to cvs.com or call your local CVS starting Saturday. We expect additional announcements from additional pharmacies very soon. This is an example of how we want to set a system up that will make vaccination as accessible as possible. A key thing to understand about the vaccinating happening in pharmacies is that the same timeline and eligibility requirements will be in place regardless of the approach to vaccinating. The same age, high-risk conditions, and geography framework will be used to determine who is eligible for an appointment, whether it's this first location type of pharmacies or whether it's one of the other two that I'm going to get into next. So, for example, when the pharmacies start vaccinating, they will be vaccinating people who are 75 and older. When additional age groups become eligible statewide, those same age groups will be eligible for appointments at pharmacies. A key is going to be, regardless of the where, regardless of any of these three locations, we're going to advance forward in a coordinated statewide approach. The second type of place where people will get vaccinated is what we are calling local and regional vaccination sites. These will include the community clinics run by cities and towns, like what happened so effectively this last weekend, because all of the vaccines that we pushed for got out into the arms of individuals 75 and older. These local and regional vaccination sites are going to be an important part of our vaccination infrastructure. For example, similar to how 5,000 doses were made available to the cities and towns last weekend, like that, we have planned 7,000 doses total will be going to cities and towns each week for 4 weeks, starting the week of February 14th. All the cities and towns will then get second doses to vaccinate the people who received first doses. To clarify, that means 7,000 doses a week divided by all the cities and towns based on population, not 7,000 doses to each city and town. I say this to emphasize that we are still only receiving a very limited supply of vaccine each week when you look at the entire population that we want to vaccinate. Scheduling will vary by city and town for these doses. One last note on where people will get vaccinated. We are working on plans now with home care agencies so homebound people can get vaccinated. Accessibility is a priority for us. That undergirds our core principal focus on equity. We're going to make sure that everyone who wants to get vaccinated will be able to get vaccinated. The third type of place where vaccination will occur, first is pharmacies, second is our local and regional vaccination sites. The third type is our state-run vaccination site. These sites aren't yet open. We expect them to be open later this month as more vaccines come into Rhode Island. This is going to be our focus for demonstrating our ability to surge quickly. If we suddenly get additional vaccines, we will have these large sites, state-run, that are ready to accelerate getting vaccines out to as many individuals as possible. Strategically, we are not going to open these sites until we have enough vaccine to run these as mass vaccination clinics. We eventually expect to stand up between 5 and 10 state-run sites throughout Rhode Island. We already have 1 or 2 that are up and running, but as we expand it for the public, we definitely are ready to expand beyond that. So to summarize where people can get vaccinated, there will be 3 types of locations: pharmacies, local and regional sites, and state-run sites. We've created a dispersed system like that intentionally. Again, learning from what we know worked successfully with testing. We want there to be many different access points because we want to be ready for when we are getting enough vaccine to vaccinate everyone who wants to get vaccinated. When you think about how many CVS and Walgreens pharmacies that are out there and the other pharmacies that we will ultimately expand to, that's a major way to make sure that there is the accessibility that's needed. And just being able to go to CVS.com and Walgreens.com and other places like that will be key. Because we are still only getting a limited amount of vaccine, relatively speaking, each week, the 3 channels that I described today will get stood up incrementally. The big news story for today is pharmacies are getting started this weekend. But when we are getting our max amount of vaccine each week, we don't want there to be any bottlenecks. So we'll keep pushing it out through the pharmacies. We'll continue to engage our local and regional connections as best and most efficiently as possible. And we'll absolutely push to the max our mass vaccination sites that are state-run. The next thing I want to address with vaccines is the how. Talked about the where. We have 3 sites. There are going to be ways to access in those 3 ways. Now I want to talk about how people will be able to sign up to get vaccinated. Again, people can think about this like testing. It works. There are a variety of systems. People just tap into what works best for them. There are many ways to get a COVID-19 test right now in Rhode Island. However, if you want to get a test through the state's testing program, there's a centralized place where you can register online. If you don't want to go through the state route to get tested, there are other approaches for being able to do that. For the state-run sites, similarly, for vaccines, you will go online and register if you are eligible, and an appointment will be made available on a first-come, first-served basis. We will also have a phone line that you will be able to call for appointments if registering online is a challenge for you. We know that that's a critical point, and so we're doing that at the pharmacies level, are supporting our local and regional approaches to make sure that accessibility is taken care of, and we'll also be doing it with the statewide approach. You will also be able to make an appointment for someone else, such as a family member. When the registration period opens for your group, it will be first come, first serve. As more vaccines come in, more appointments will be open. And to be clear, there are currently no appointments available to the public yet at the state-run sites. Again, those are more of the mass vaccination clinics. And as we get more doses, enough to really feed the vaccines out through that route, we will then be ready to push it there, ready to surge at any moment that we need to. We would welcome that challenge. We expect that people who are 75 years of age and older will be able to start registering for clinics through the statewide approach closer to the middle of the month. This will be when we have enough vaccine to start operating those larger clinics. As we get closer to that point, we will provide people with the website and phone number that people will be able to use. So similar to testing, we're going to want to layer on the options that are available. I want to say up front that people should be prepared to not get an appointment right away necessarily. We recognize that this will be frustrating. It's frustrating for us too. It's happening in states across the country, but taking the first come, first serve approach has been seen in multiple areas as likely the most efficient way and quickest way to push vaccine out. We are one of the states that are taking multiple layers at doing that so that we can cover from a variety of perspectives, the pharmacies, the state-run approach, as well as the local and regional approaches. Right now, we are only getting a little more than 16,000 first doses of vaccine a week. It increased from 14,000 just within the last week or so. But it's important to know that that 16,000 compares to the 80,000 people in Rhode Island who are 75 and older. A portion of them have already begun being vaccinated over the last several weeks for those living in congregate settings or other assisted living settings. But there is a remainder that's way more than the 16,000 a week that we're getting. We are hopeful that more vaccine will start coming into Rhode Island. But the 16,000 first doses a week is the reality that we have to live with right now and plan for the time being. Everything I've just said pertains to getting information about eligibility and registering to get vaccinated at a state-run vaccination site. As I said earlier, and will continue to share, there are going to be multiple ways: the state-run version, the pharmacy version, and the local regional approach. For the pharmacy, the registration process for pharmacies is going to be distinct. To register, you will go to the pharmacy's website, as I said earlier. However, you will only be able to register if you are eligible at that time, and that eligibility will stay the same across all three approaches. Registration for the local and regional vaccination clinics will be site-specific. For example, many cities and towns have their own lists of people to contact. They will still use those lists for regional and local clinics. Separately, as I did last week, I want to share a quick note on testing and a quick note on treatment so that it's clear our overall focus for getting us through the remainder of this response is vaccination, testing, and treatment. On testing, we currently have more capacity than ever. We have testing locations in almost every city and town throughout Rhode Island, and you can make same-day appointments at many of them at portal.ri.gov. Getting tested every week is fast, it's easy, it's free, and it's more important now than ever, particularly with the potential for the new strains of COVID-19 in circulation. So I recommend to everyone to consider getting tested every week. And lastly, a plug for treatment. If you test positive for COVID-19, and if you are 65 or older, or have an underlying health condition at any age, immediately call your healthcare provider and ask about treatment for COVID-19 that is available for you. If you don't have a healthcare provider, it is still available for you. To learn more, go to covid.ri.gov/treatment. At some sites, you can find out how to access treatment. At that site, you can find out more how to access treatment if you don't have a doctor. We have been seeing great results with patients who are getting treated, and we have plenty of supply in Rhode Island. Treatment is one of our key tools to keeping people out of the hospital and keeping people alive, just like our approach with vaccination. Before opening things up for questions, I want to mention the Super Bowl. Many of you may not know I'm a huge football fan, so it's a big day. I know a lot of people are excited for the big game, this particular one. I am too. I'm definitely going to be watching the Bucs and the Chiefs, but I'm going to be watching just with the people that I live with. The social gathering size in Rhode Island is still just your household. Please come up with additional ways to celebrate or watch in awe creatively. Watch a game virtually together with another household. But keep it small, keep it simple, and just watch the game in person with the people that you live with. With that, I'm going to pass it on to Secretary Pryor.
Good afternoon. Lieutenant Governor McKee, thank you very much for the opportunity to address the audience. Dr. Alexander Scott, thank you for your leadership and partnership all the way through this pandemic. And thank you, Governor Raimondo and Lieutenant Governor McKee, for giving us the opportunity to release businesses from some of the restrictions. Given the improved public health conditions, as you promised we would, we are very, very grateful. So with the recent improvements in the public health landscape, we've looked at each industry sector and sought ways in which we can incrementally improve conditions and open up for business activity. As you know, last week we ended the early closure requirement for restaurants as well as recreation, entertainment, gyms, fitness centers, and indoor sports facilities. We were very pleased to be able to do so. This week we'll be undertaking measures to provide additional flexibility. I'm going to go through those. May I ask, please display the slide, if you haven't already, on the screen. There's a new table of the restrictions and the new loosenings, if you will. Now, Dr. Alexander Scott has explained this well, and this is in consultation with the outgoing and incoming governor. We know that there could be a need for a tightening of restrictions if these new strains arise. We certainly hope that does not happen, but they've created a window for us to loosen restrictions and to enable more economic activity. We know that every day that a business is able to operate with increased activity, increased revenue, matters enormously, especially for our smallest businesses. So thank you. So here we go. I'm going to describe some of the changes that will go into effect, and they will in fact go into effect tomorrow. For catered events, events with professional caterers, capacity limits will increase from the current 15-person cap to 30 for all events, that's indoor events, and for 50 people outdoors, with some provisions. One, there must be pre-event testing for all event attendees, and we will work on the precise protocols for such testing. And a designated event COVID safety officer needs to be assigned at the event on the catering or event production team. Also, restaurant rules must be followed, so that's table spacing, mask wearing when not actually consuming, no standing service, things of that nature. Those restaurant rules must be applied and must be adhered to in the catered event. I will note, for weddings in particular, we are going to provide additional flexibility. I want to thank Luke Renshin and Erica Trombetti. Lieutenant Governor McKee and I have relied upon a coalition of event professionals for our input, and the Lieutenant Governor and I are grateful to Luke and Erica and the whole team. We've developed a method here for opening up these events. In fact, we've done, with grant from Commerce and with leadership from Luke and Erica, produced a video to help event professionals conduct safe events, and it's for these reasons we can do this. So for weddings, taking on all of those mutually developed requirements, we will allow up to 50 people. We know that the event industry centers on weddings as events in particular, so we are providing that flexibility. For indoor dining, we are pleased that we will be able to offer incremental flexibility around the one household rule. Currently, only one household is permitted to be seated at a given table at a restaurant in Rhode Island. We will allow for indoor dining up to 2 households, and for outside dining, outdoor dining, we are going to allow an increase from 2 households to 3 households. Currently, you can do outdoor dining with 2, up to 3, all up to 8 people at a given table. And we're grateful to all those restaurants that are using the heat lamps that they've purchased or that they've purchased with assistance from our Take It Outside campaign in order to keep outdoor dining going. That remains the safest way to go. I want to thank the Hospitality Association, the Ocean State Coalition, and the Small Business Coalition, all of whom Governor Raimondo, Lieutenant Governor McKee, and I have relied upon for input, and they've been enormously helpful in providing constructive criticism and valuable feedback to enable these restaurant moves. For offices, we've heard from an array of stakeholders, large-scale and small-scale office users, that the work-at-home requirement for those that are able, the requirement has added burden. We continue to encourage all workers and all business units that can be remote, all people who can work remotely ought to. We encourage that to happen. However, we are enabling up to 33% of those working remotely to return to offices. Please, C-suite executives, business owners, managers, please keep in mind we do encourage remote work where it can continue. It does help reduce the rate of spread. But we will enable that up to 33% return to occur. And we are grateful to the Partnership for Rhode Island, for example, Tom Giordano and Tom Lawson of FM Global for their continuing partnership and feedback through this entire process on behalf of businesses. For gyms and sports facilities, we've heard numerous gyms, yoga studios, and others express that the constraints are too severe to operate, especially for the smallest studios. It's become very burdensome. We know that. We want you to be able to open if you haven't yet, or to have the kind of customer flow that will enable you to better than break even, to make a profit, for goodness sake. The current capacity limits are 1 person per 150 square feet. We're going to enable increased density by allowing that figure to increase to, or that is to say, the density requirement to be modified to 1 person per 125 square feet. If you have more people in the given space, it enables a better clientele density and enables that business to operate. That 125 improvement from 150 represents a 20% improvement for the given facilities. In addition, there's a spacing requirement that's been a hindrance, which is that we've been requiring 14 feet distance between clients, between the individuals in the given gym or fitness center. We're now going to reduce that spacing requirement to 6 feet from 14. There will additionally be a new approval process for the smallest gyms and studios, where even those flexibilities are not sufficiently helpful. With DBR's assistance, working in consultation with Dr. Alexander Scott's health department, there will be an appeals process, if you will, where if you can demonstrate appropriate mitigation, for example, as Dr. Alexander Scott has illustrated, ventilation, the number of air changes in a given hour, also, for example, testing all clients at a given gym or fitness studio, then we may be able for the smallest studios to provide additional flexibility. So DBR and RIDA will be developing some internal guidance for that purpose, and there will be an opportunity to appeal for that purpose. For indoor recreational businesses, similarly, the capacity limits will improve, so there'll be 1 person per 125 square feet instead of the 1 per 150. And spacing requirements will once again be 6 feet rather than the 14 feet that makes business more challenging to operate. So we're very, very pleased that we were able to make these changes. We're grateful for the continuing advocacy and partnership of the Lieutenant Governor. Your leadership is terrific and your insights are invaluable, and we're grateful to Governor Raimondo for authorizing these additional changes. We aim to do more. We know, for example, that restaurant owners are concerned about bar spaces, and that bars themselves are concerned about operations. We continue to dialogue with restaurant and bar owners about possible conditions under which we may be able to relax restrictions modestly. So more to come on that subject, we hope, as we monitor the public health data. One last plug for small business owners especially, and for all business owners. In partnership with and under the leadership of Governor Raimondo and Lieutenant Governor McKee, we have reached out to businesses to help them secure PPP loans, the forgivable loans that the SBA offers. A very quick plug that if you're a business considering this, please know that we have technical assistance partners for this purpose. We have a half a dozen partners at Commerce, Rhode Island, ranging from the Multicultural Innovation Center to the Rhode Island Hospitality Association, the Society of CPAs. I won't name them all. Multiple constituencies are represented, and multiple stakeholder groups have signed up to help their own constituent businesses get signed up for PPP. In addition, at least 10 Rhode Island banks are accepting first-time applicants for the federal PPP program. Rhode Island Commerce has been, with the encouragement of the outgoing and incoming governor, has been compiling this list. There are over 10 banks that will accept unbanked businesses for consideration and are taking first-time applications. If you wish any of this information, the technical assistance partners, or if you wish to find out about the Rhode Island banks that are serving those that are not yet in the program, please contact info@commerceri.com, info@commerceri.com. Once again, Lieutenant Governor, thank you very, very much for leading us and enabling these changes and these opportunities for businesses, including small businesses. And now to you, sir.
Thank you. Yeah, thanks, Stephen. Clearly our focus is where Dr. Scott has put us, but the economy is also a critical piece, as well as the schools. But today we're talking about the, what we've been doing, what I've been doing in preparation of this, in this transition. And so we're heavily engaged with Dr. Alexander Scott, along with the team that is in place to make sure that we're doing everything we can to keep people safe in the state of Rhode Island. So that's what I want people to know, that we are actively involved in a way that you would expect. And I would think that we're going to see many, many advancements on top of the good work that's been happening over the last 10 months. We also engaged with the governors throughout the country. It was on my second call this week with the White House and talking about ways that the Biden administration are going to help our states, including this week where they mentioned that all FEMA expenses are going to go retroactive to 2020, and 100% of that coverage is going to be provided to the states, which I think is an indication about what is coming our way to make sure that our state is fiscally sound as well as safe. As far as the testing goes, it has been announced, and we'll make sure that we'll keep track of it and keep you track about what the additional vaccines look like. Dr. Alexander Scott mentioned that we moved from a 14 to a 16 and change doses per week. We want to make sure that we're doing everything we possibly can to get those vaccines out as quickly as possible and into the arms of the people who most need it, as Dr. Scott has outlined, and I don't have to go into more detail on that. I think one key thing that happened this week is that we've engaged the municipal leaders. We've engaged the municipal leaders in a way that now the interaction is real, and I believe that they're going to play a significant role as a result of that interaction, not only with meetings, several hours of meetings with our municipal leaders, collectively and individually, both with me and with Dr. Alexander Scott's team, to make sure that we insert our municipal leadership in a way that is going to help get those vaccines out as quickly as possible to the people that, as Dr. Alexander Scott has outlined. So both Dr. Alexander Scott know and I know it's critical to engage municipal leaders. And they stand ready to do what it takes to keep their communities safe, but also do what it takes to coordinate in a way that I did as a mayor, bringing municipal leaders together to talk about the most important issues that face our communities. And right now, the most important issue that we have is the safety of the individuals that live in our communities. So I'll leave it at that, but I do want to just echo what the Secretary said. PPP loans, critical that we do everything we can to make sure that every single small business in the state of Rhode Island accesses those dollars. And I would ask the local media to really reinforce that. Last time, close to $2 billion came into the state of Rhode Island. This time, we are going to try to exceed that. And I think that we are prepared with the work that we've done and Commerce has done to make sure that we get those dollars into the state of Rhode Island in a way that's going to help our small businesses with the understanding that those dollars circulate 2, 3, 4 times. So the advantage there is significant and very important. And the other one mentioned in terms of the grants and the CARES Act, I would expect that we'll certainly bring that forward again and identifying ways that we can help the small businesses do that. And then finally, the incremental flexibility that you started to see today. I think you'll see more of that, but we also have to understand that we need to make sure that we keep the infection rates down. We need to make sure that our hospitalization rates are down. And ultimately, we want to make sure that the death rate vanishes. It's gone. But we want to do everything we can to make that happen. And as Dr. Alexander Scott said, the strains that are out there are real, and we need to make sure that everybody in our state protects themselves with their masks, social distance, follow some of the thoughts that we have expressed here today to keep you safe over this weekend so that we can continue to keep people safe in the state of Rhode Island and also open up our economy. I'll leave it at that, and any questions that you might have for...
Dr. When you hear about the criticism of the slow rollout, when you hear about the criticism of getting the vaccine too slowly to older Rhode Islanders, and you say there's just not enough vaccine, can you break it down for people? Where is the rest of the vaccine right now going that there's not enough for those older Rhode Islanders? So you pushed out 5,000 doses last week, 7,000 in the next round. Where is the rest of it, and why isn't it going to those groups? If you could just tell people where it's going.
Absolutely. So the first understanding is knowing that our total amount that we're getting is low within itself. So it's not as if, there's some extra stash somewhere that is not going to 75-year-olds. We need additional vaccine to come in. When I mentioned that we have 16,000 now, up from the 14,000, this next week coming is going to be the first time that we did not have to push almost half of our prior week's amounts through the pharmacy partnership, which is what was used to vaccinate seniors in long-term care facilities, as well as vaccinate our more vulnerable populations in other congregate settings. So we really had like 7,000 each week. So this week coming is the first time that we actually have the full amount that we receive that can go to the individuals. We are expanding to 75-year-olds, and I shared that we piloted that expansion starting earlier this last week as we were able to pull back additional vaccine that had not been used yet. The remainder of the vaccine is continuing to finish the first phase groups. We had groups 1.1 through 1.4. There are people still being vaccinated in those high priority groups. True to what we have continued to say, we are not waiting to complete each of those groups within the phase to start the next group. And so that's why, as we get more vaccine, we will continue to push out more to the 75 and older.
Just one follow-up. Given the limitations that you've pointed out, the timeline that you set last week to begin 65 and older in mid-February, which is now just a week to 10 days away, is that, in hindsight, now too aggressive of a timeline, or an unrealistic timeline to have 65 and older expect to begin within a week to 10 days?
Yeah, so it will be more so the middle of February to the end of February. It's really recognizing that we want to get as much out as we can. Now that we'll be able to commit all of the 16,000 that we get to vaccine that's able to go out, it does support for being able to move the 65 and older into the range that we have said previously. And we will continue to appeal to the federal government for additional supply so that we can go further. And as we've talked about, getting through this bumpiness, continuing to see where we can refine, there have been vaccines through the pharmacy partnership, which is why Rhode Island ends up being acknowledged as one of the slower states. We are one of the states that has fully embraced that federal pharmacy partnership. Some of the quicker states went around that and didn't use it to get vaccine out, but we thought it was critical to get it to our long-term care facility groups. So as we are able to focus more on using all of our supply, we hope to be able to get to the 65 and older and push beyond that from there.
Dr. Alexander Scott, I get a lot of email from parents of kids who are playing high school sports. Mm-hmm. And with the relaxation, a little bit of a relaxation, you may not know now, but when your son plays sports, there are days that you just will not get back. And they're at that point right now. And so there seems to be this Bermuda Triangle of the Department of Health, the superintendents and the athletic directors, and then the Rhode Island Interscholastic League. And I know you've, and Janet Coyte's been working with them. Why can't you start to loosen up given all of these restrictions? What is the science and the data that is driving your decision to not allow parents who will never get this opportunity again, senior years, at least have the senior parents to be able to go and watch their kids play sports?
We do have allowance for spectators, to attend to the sports events, specifically taking that into account, whereas other states did not necessarily focus on that at all. So we recognize the importance. The data and science behind the decision was the understanding that with sports, we are seeing cases that are occurring in athletic events. That then brings together more families and individuals who are socializing in ways that are important for supporting the youth, and a way to help allow for the sports activities that we know are critical to occur is to just be thoughtful about limiting the spectators so a parent can attend but not have the full group in person.
Some superintendents, there are some districts that are not allowing any parents for any sports. Okay. So what's the word right now to the superintendents listening to this?
Well, we will take that information from you on which superintendents those are and help make sure that they have the updated recommendation that I just shared. And I want to really thank Janet Coy, the entire DEM team, Sandra Powell, so many others, and the Rhode Island Interscholastic League, who has been an excellent partner with us. We'll continue to engage with the superintendents so that they know we do want or allow for a parent to be able to support, and we'll find out from you which ones so we can get that to them.
Just one other unrelated topic. You had said in the early days, you had acknowledged Governor Raimondo, you had said her leadership was brilliant. The reality is the last 6 weeks, she's hung you out to dry. And everybody else up here, by not answering questions and having questions that you have to answer that should be in her wheelhouse. And a lot of people with these decisions that are announced today want to know who is making that decision. Is it you? Is it the governor signing an executive order? And has she apologized to you for you having to carry her water when she should be at that podium?
Well, I will 110% stand behind my statement about Governor Raimondo's brilliance and the tremendous work that she has put in and continues to put in to make sure that we have a strong structure for going forward. There are no apologies needed for that at all. We have a united team here. I'm appreciative of having my colleague, Secretary Pryor, and the entire team that's continuing to work together with the whole of government approach that we've had from the early days. In terms of engagement now, we are conducting meetings, as the Lieutenant Governor said, with both the incoming and outcoming governor together. We're making sure that there's a strong transition. We're continuing daily interactions, and Rhode Islanders can be assured that the same structure and strong approach that we've had with public health, our team, our overall COVID response team at the forefront is continuing forward.
But you can only have one governor, as Lieutenant Governor McKee has said. Is she making the decisions right now? Does she have final say on all of these things that you're announcing today?
Both governors are involved, and as we have stated, both have been working very well, collaboratively together and supporting our teams. That's what Rhode Islanders need.
Doctor, Salve Regina has gone to sort of a lockdown situation for students. What do you say to Rhode Islanders that are concerned about, as things are opening up, colleges are back in session, that recipe right there? Are you concerned about colleges contributing to a possible rise in cases with the new variants or other ones?
I appreciate that question because I can really speak to the tremendous amount of work that has gone into ensuring that our institutes of higher ed are prepared. I want to really give them credit, give our team credit. Several weeks ago, we built out an extensive panel of criteria based on 5 categories of items that institutes of higher ed would have to have operationally strong, resourced, and ready to go in order to effectively open their doors for the onslaught of young adults to return to Rhode Island. We were detail-oriented, we were specific with them, they were responsive, they have done everything they've needed to do in making sure that the testing program is strong, case investigation and contact tracing is strong. We applied all the lessons learned from enforcement and ensuring that students, whether on campus or off campus, are doing what they need to do, and the ability to minimize crowding and the population size of the colleges and universities. So Rhode Islanders can know that we have done all the steps we could imagine needing to do to make it so that students could return to their institutes of higher ed with all of the precautions for safety in place. We've worked closely with Salve as well as with the other colleges and universities as they're reopening. We're identifying more because we have an even more detailed testing and surveillance program in place, and we'll support each of the IHEs, knowing the tremendous work that they did to make this work and how they want to handle each of the cases. So Salve decided to go virtual as a way to respond. We have supported that and will continue to work with each institute of higher ed in ensuring that we are all doing the best we can to keep students safe and Rhode Islanders overall.
So it's not just so much for the students, but for the communities around these schools. That's where we're hearing a lot of concern. People are saying, hey, wait a minute, I live on College Hill. I'm seeing kids out and about at night, whatever it may be. I mean, that's a normal year. Should they be worried?
Yeah, because of the work that I expressed, institutes of higher ed have systems in place where they want to know. They're monitoring. If there's something that's going on in that college or university community that they see that is of concern, go ahead and reach out to them. They'll be able to activate the resources that have been put in place to help protect against any cause for a large outbreak.
Mr. On the vaccination rollout, that's where we're getting most of our questions about. So you're talking about 3 different types of locations to get a vaccine. That also means 3 different potential ways or avenues to register. Is that right?
Yes.
And then secondly, the CVS doses that are coming out are in addition to, if I'm correct, the supply that the state is getting in each week. Is that right?
Eventually, that is what is intended to happen. Right now, we're making sure that we have what's needed for CVS to get started on the timeline. We still need to get updates from the feds who pushed back the time frame that they told us they would have vaccine for this week. That's above what we're currently getting, and now we'll have to wait to see when that will actually happen.
Is it ultimately the goal to have CVS, Walgreens, any other pharmacies that join in here to be able to supply their own so you have multiple streams of vaccines coming in?
Absolutely.
Mr.
And
Pryor.
have it be as accessible as possible. I also want to clarify the point that I made about making sure that those who are homebound have access. The key there was to really relay that we are doing everything to take into account all of the different possibilities for ensuring equitable access across the board. So for the homebound piece, we are still in the planning phases. I want to make sure that people are not going and calling our home health agencies right now, looking for their vaccine right now. We are still planning that, but wanted to relay to Rhode Islanders that we're taking into account all of the different considerations that are critical. But please don't start calling home health agencies right now.
On the question involving the 3 separate types of locations to get a vaccine, to be assured of getting a vaccine, should people apply and register with multiple sites, Walgreens, CVS, community centers? Would that ensure that they get an appointment to get the vaccine?
Our goal is to make it so that any one route that you take is effective at being able to get scheduled for a vaccine. But we are purposely offering the multiple options so that people can take advantage of any option that they would like to.
They're not going to get excluded if they sign up for multiple
That is correct.
sites.
They will absolutely not get excluded.
That would ensure their, CVS talk to Walgreens, talk to the state. Is there an interplay there?
The interplay will be across the board, both on the individual. If you already have received your vaccine, you can, cancel any other scheduled appointment or not go to look to get scheduled someplace else. That's certainly happening in states, throughout the country. And then where we can, we will also be coordinating, certainly with our local and regional clinic approaches.
Prior to sign up with clinics, with pharmacies, multiple locations.
It is absolutely okay to do so. Similar to testing, we allow every route possible for you to be able to access.
Mr. Pryor, can we get a question from you at the podium, please? You mentioned that you're in communication with businesses and restaurants. Now, every restaurant seems to say they need the bar area open in order to make money. Now, next weekend is Valentine's weekend. Why not now open up and allow restaurants to now start to seat people at the bar area?
We in Commerce hear that feedback frequently, so we have been working closely with the Hospitality Association and the other aforementioned associations to figure out what the plans could be if there is an opportunity to reopen. There needs to be consensus within this administration that the public health conditions will permit that. Bars are one of the locations that globally, across the entire world, public health officials point to and you know, with caution. They say reopen or open with caution. I have to say, in Rhode Island, we should be enormously proud of the bar owners and the restaurant owners with bar areas and the kinds of precautions that they have put in place. They've put the plexiglass in when such requirements existed. The evolution of this virus has evolved. The airborne nature of the virus is better understood. They've worked with us for early closure purposes. Remember, there was a bar early closure mechanism, rule, that preceded the overall early closure and the stay-at-home early stay-at-home advisory. So all of this to say, we're so proud of restaurant owners with bars and of bar owners and their expertise and their professionalism. So therefore, even given the cautions, and even given that there are strains apparently on the way that we need to monitor very, very closely, we are talking with restaurant and bar owners about possibilities. So please stay tuned. It's possible that at this time next week we will have more that we can say, and we'll be evaluating that question closely.
Are you hearing from some restaurant owners that say, I don't want my bar open for seating?
Well, yes. I mean, there are restaurant owners. There's an entire spectrum of restaurant opinion.
Just so we
there
know,
are certainly
is it like 80-20? Like
just let me finish my response. Good question, by the way. There are restaurant owners who, in fact, don't feel comfortable reopening at all, and they're hibernating, in effect. No matter what rules we put in place, even if it were an entire open scenario, they wouldn't reopen. That's their point of view as professionals. I would not say that's the majority, not at all. There are bar owners and restaurant owners with bar areas who also just don't feel comfortable with that. The majority do want to reopen their bar seating. The scenario that they expressed to us, to be clear, is that it's not that they wish to operate a bar per se. Yes, in the ordinary times, in the old normal, they wanted to open a bar. The seating itself may be a big slice of the capacity of the establishment. So we hear that with frequency. It's very understandable, and that's why we're working so hard at it. I've got to leave it there because we're continuing to conduct analysis, but we from Commerce are continuing to provide the input on the ways in which bars could be reopened.
Now, your Rhode Island Commerce.
Secretary Pryor.
Let me follow up. Governor Raimondo is going to be Commerce Secretary. Have you talked to her about going to Washington? Would you go to D.C. if Governor Raimondo asked you?
I'm not going to characterize my conversations, the private conversations that I do have with the outgoing governor or with the incoming governor. So if any of us have more to say on any of these issues, we will say it.
Did you see her State of the State last night?
I did.
Okay. You deal with all businesses, some owned by men, correct? Some owned by women, correct? Governor Raimondo last night said the pandemic has affected women more. Do you agree with that? Do you deal with business owners? Have female business owners somehow been impacted more by the pandemic than male business owners?
Well, I'll say this. Under the Raimondo administration, we have established new programming for small businesses. And one of the things that we very much acknowledge is that women-owned businesses often face more barriers, access to capital, historic discrimination and other biases, as is true for minority-owned businesses. So we do need to make special effort under the ordinary times. In the old normal, we had to take special effort to ensure equity and access for small business owners, including women-owned businesses, and we've done so. I'm proud of the fact that in the first ever state-financed small business loan program, our SBAP program, we've offered more than half of our loans to women and minority-owned businesses. Governor Raimondo knows, as an entrepreneur herself, when she established her business in Rhode Island, that it's challenging for women to do business not just in Rhode Island, across the country and world. So yes, of course, unfortunately, when there are disproportionate impacts within the context of a crisis like a pandemic, the place where those disproportionate impacts lie is for those populations and communities that are facing the greatest barriers to begin with, which is why Dr. Alexander Scott and Governor Raimondo have all along emphasized extra outreach to those that may be coming from behind. So certainly women-owned businesses have faced barriers in the old normal and in this unusual normal in terms of surviving and thriving. So I think that's entirely accurate, and it's been a privilege to work under our first woman governor who gets these issues. She's been an entrepreneur in her background. By the way, Lieutenant Governor McKee is a small business owner, operator, entrepreneur himself, and offers that spotlight as well. So we're very grateful. Was there another question?
Yeah, a question for you and the governor, the new governor. Astonished as we sat here to read, based on the fine reporting of the Providence Journal, that just a mere weeks after Rhode Islanders had patted themselves on the back after dodging the financial bullet of the now Worcester Stadium, which is now the most expensive stadium in minor league sports history, that we are now the proud soon-to-be investors in a soccer stadium. So let's go down the list, if you will. This is a state where small business owners are very often given $500 checks during a state-imposed purge, only because the state can't afford that. This is a state that is literally investing in a business that will act as competition to private investors and private businesses already existing in a state, where we've just spent the last hour and a half describing how they literally can't fully operate. We're investing in a business where the Gillette Stadium facility isn't even sold out for a Major League Soccer game. By what definition of the madness that this state runs in are we capable of a $50 million, including a $36 million loan, to a business that may not ever be able to operate on a normal level? Where does this come from?
Appreciate the question. I'm pleased to be able to speak to the Tidewater Landing project on this day. One of the things that Governor Raimondo and Lieutenant Governor McKee have emphasized is that this project financing must be revenue positive. It must, in fact, be a project that pays for itself and more. And, excuse me, I'm going to finish my. Your question was very intelligent, but it had multiple parts, and I'm going to respond. So we're pleased that this is, in fact, a revenue-positive transaction, and we've worked very hard to ensure that it is, in partnership with the City of Pawtucket and with the private partners at Fortuitous. I want to note a few things. You mentioned the Paw Sox and Worcester iteration thereof. I want to point out a few very important things about this project, and we can be very proud of this as Rhode Islanders. Number one, the investments that we are proposing are to the public infrastructure to support the project, not to the stadium itself. The stadium itself, the facility, will be privately financed, number one. Very much in contrast with many transactions across the country, many stadium projects across the country. Number two, as in contrast with the Paw Sox proposal to Rhode Island, the developers of this $284 million project are bringing 5 times more private money to the project themselves, 5x what the Paw Sox owners were willing to do. Also, after negotiations with the Paw Sox owners, we were able to bring forward in that draft proposal from them a willingness to develop 50,000 square feet of ancillary development beyond the stadium itself, 50,000 square feet, the Paw Sox. This development will leverage over 500,000 square feet of development for Pawtucket. Pawtucket is a city that is emerging economically. It's seen very tough times, including during COVID. But I want to note something about Pawtucket and why it's a worthy place to invest for soccer and for economic development. In 1913, Pawtucket held the very first U.S. Open soccer tournament, the nation's first U.S. Open for soccer was held in Pawtucket, Rhode Island, and we're proud of the fact that that precedent set on Lonsdale Field in our very own Pawtucket could be followed through with a development of this magnitude that pays for itself, and that will also bring economic vitality to our entire state.
Absolutely. The vaccine subcommittee is legislatively established. It has been in place, brought together by experts, has been critical to our drive forward, and will absolutely be continuing. There's no change. I'm glad to be able to share that and to say thank you to that subcommittee. The transition advisory group that the Lieutenant Governor has mentioned is really his focus on getting input from the community level, municipal engagement, on all the things connected to COVID, which is vaccine prominent right now, but is really focused on his arrival and intel from that transition standpoint. That is distinct and separate from the legislatively acquired vaccine subcommittee that will absolutely continue and guide us through the remainder of this response.